All right, y'all, this is Karen. I'm going to try to do this as quick as I can to try to help you get over your fear of your medication checkoff. Yes, it's a scary thing. We've already talked about that. So, just to kind of familiarize you, in one bin you may have, or you will have, your blunt cannulas, your needles of different sizes, your 1 ml precision syringe. You will have your insulin syringes. You will have an ID bracelet, alcohol preps, Band-Aids. All that will be in one bin, or the other. It'll all be in one of the two bins. You'll have two bins to work out of. Then the other bin will have all your medications in them that you will be working with in your cups. So when you first come in, you will be given your math problems. On your math problem, you're going to sit down and work them, and then you will go to the faculty person for them to check your math. Once it has been determined that that is correct, which I expect everybody will fly high on that part, don't come in and try to race through to just get it done to try to run with the group. I want you to take and do it correctly. We did say you could bring a small calculator with you if you really felt like you need to have it. Okay, so my medications are insulin, MPH, Lasix, amoxicillin, and Lipitor. So, when I did my math, and it has been checked, I'm given 5 units of MPH insulin, 40 milligrams of Lasix, which is 0.5, amoxicillin, 125 milligrams, which is 5 mLs, and a Lipitor, 1 tablet, 10 milligrams. So, I'm going to go ahead and just get my cups ready. Have them sitting out here. And I haven't found a way to show all of me in with this so that you will see everything, but I want you to see this part. Now, the one thing that we have not been doing that we kind of discussed is when you're getting medication ready, we do want you to have gloves on. Okay? So, I'm ready to go over here to my next instructor to explain what I'm giving. So, I am going to be giving amoxicillin, 125 milliliters, 5 mLs, for a sinus infection and an ear infection. The patient has taken it before and it worked well, so we're going to use it again. However, we want them to know that this may upset their stomach. They may have nausea, vomiting. They may end up with diarrhea. Also, they may end up with a rash or just redness, itching. If any of that occurs, they do need to let us know so we can determine if we need to change the medication. So I've got to give 5 mLs. On your medication cups, you have cc's, you have mLs, you have teaspoons, you have ounces, and drams. Always set this on a hard surface. Do not hold it. You should have had that. Palm the label of the medicine so that you don't have medicine running down the label that tells you what you've got. And then just very carefully, we're going to pour it in here. We will have shaken this up. Okay. I brought me a paper towel because I personally know I dribble when I pour medicine down the bottle. So I want to dry it off so I don't get it on everything, and then just throw the paper towel away. The next thing I'm going to do is set this right here. Now I'm going to prepare my Lipitor. My Lipitor is 10 milligrams. It is for hypercholesterolemia. It is taken at bedtime. It's 10 milligrams. Some of the side effects, major side effects, is weakness, just feeling like your muscles are weak, like you can't hardly hold yourself up. If that occurs, you need to notify the doctor immediately. All right, so there's my Lipitor. My next thing I'm going to draw up is going to be my insulin. Now remember, MPH is cloudy, so I'm rotating it to make sure that it is mixed up. You will not have MPH. You will have regular insulins for sliding scales. Okay? So I'm going to get my syringe and my alcohol prep. I'm going to clean the top of my bottle. I'm going to draw up my 5 units into my syringe. And I'm going to put it into my vial and invert it. Now remember, I told you to pull down more than you need so you can flip that bubble out. This one here is not working for me, so I'm going to start over here. I'm afraid I was getting that up too high. Some of y'all were having really issues. Okay, my needle is bent all to pieces, so I have to discard it. Alright, so we're going to try it again. Now that's just something that happens with these smaller needles. They do bend. Oh, that one drew up a whole lot better. I don't have any air in it. So we have 5 units. Once again, we're going to do the scooping to put my cap back on. All right, my next thing I'm going to draw up is going to be my Lasix. So I know I need me a blunt catheter and I need me a 25 gauge, because that's what you're going to use to give your injections. Remember, we talked about this dagger needle that it is. It's small. We're not making you stick with the big needles like what you normally would for an IM injection. And I'm putting my blunt cannula. Okay, so on my Lasix, we said I have to give 0.5. And it's clear. So with my Lasix, let's go back and let me tell you about my side effects for my NPH. It would be hypoglycemia, meaning their blood sugar is going to drop. They may be shaking, they may be tremoring, they may be ill, cantankerous, unwilling to cooperate. That's all part of having a low blood sugar. What they would do for that is have a snack, right? Right. Alright, on this one I need 0.5. I'm using my blunt cannula to draw it up. Lasix is to help remove fluid or edema from the body, where fluid is expanding out into parts where we don't want it or staying in the vascular system, not returning. The purpose of the Lasix is going to make you urinate a whole lot or make you pee a whole lot. That is the expected outcome. It may also lower your potassium, so if you start having leg cramps, then you need to notify the physician so that they can check your potassium and see if that is a problem for you. Low potassium can cause you to have cardiac arrhythmias. So if it gets like 2.9, 2.6, yeah, we're concerned and we may be bringing you in to give you some potassium in a hospital setting. All right, so now I've got all my medicines ready. So I'm going in. Hello, I'm Karen. I'm here to give you your medicines. Can you tell me your name and your date of birth? Okay, we have Jackie Smith, 1182. She's allergic to penicillin. Oh, no. That's an error. Jackie is not allergic to penicillin. She is allergic to codeine and C-chlor. All right, so now we know we're good. We know she's not allergic to the medicines we're giving. First, I'm going to give her Lipitor. This here is for your high cholesterol. We want to bring it down so that the plaque does not build up in your system. We give it to her, she has water, that pill down. And actually, they're not swallowing the pills. Okay, the next one is amoxicillin for your sinus and ear infection. This is 125 milligrams. We are hoping that it will knock your infection out without giving you a rash, redness, itchiness. It may cause some abdominal discomforts, nausea, hopefully no vomiting, but it could, and it could give you diarrhea. Okay, that's in. Now then, I need to give you your insulin shot. I'm giving you 5 units of NPH. If you start to feel like you have a low blood sugar, whether it's shaking, whether it is tremors, shaking, just feeling faint, feeling dizzy, please let us know so we can check your blood sugar and have you a snack if that's what you need. We can give this to you in your abdomen, in the back of your arms, in your thighs, in the back of your hips, anywhere where you have fat. You want it in your stomach. All right, so I'm going to make sure I'm 2 fingers away from the umbilicus. I'm going to clean it. Pinch it. And I'm going in at 90 degrees. Giving them. I would turn around and automatically put that in my needle box. That way nobody else can be stuck by it. All right. So our last thing that I need to give you is your Lasix injection. Like I said, this will make you go to the bathroom, so we expect you to urinate a whole lot. It will also decrease your weight possibly. You may be a little hypovolemic from the losing of fluids, meaning that you feel dizzy. When you stand up, you may have a blood pressure drop. So just stand there for a minute till your head clears before you start walking. If it does not clear, sit down, call someone for help so that we can help you. But like I said, we expect you to urinate a whole lot with this. We need you to let us know when you go so we can measure it. We also need you to keep up with how much you're drinking. And when you go home, if you go home on Lasix, then you will need to weigh daily. Okay? So we're in agreement that we understand that. So now I'm going to clean on the arm, so we know we're going to go here at the process and 3 fingers down and give it here. So here we go. I've got it located. I'm ready. Yep, I can't get my towel off. There we go. 1, 2, 3. And I cheat. It is not recommended that you aspirate now on any injections. Once again, I'm going to turn around and discard my needle. All right. So now we're going to clean up. And your instructor at the final station will sign off or tell you what you did not do correctly that you need to practice on. Hopefully we're not going to have any of that, and hopefully this video has helped to alleviate some of your concerns. We will have open lab Thursday morning, 8:30 to 10:30 if you want to come in and practice. I'm sorry, Thursday afternoon open lab has to be canceled because we are having a mandatory faculty meeting. All right, if you have any questions, please let me know.